And hi again, my name is Dylan Black. This is Daytime Ottawa on Rogers TV. You know it's a busy show. We've got that covered for you. Right now, let's talk about how to lose weight in the year 2018. It can be done. A couple of specialists with us right now. Let's say hello, first of all, to Dr. Judy Shiau. Nice to see you.
Thank you very much, Dylan.
You are the medical director of Leaf Weight Management Clinic, and Danielle Aldous is with us as well, the lead dietitian. Good to see you as well.
And you.
All right, so 2018, this can be done. We can get people back on track. Am I correct, doctor?
Absolutely. And in fact, we're talking more about the journey of a person going through weight management. And really, our hopes are to continue their story and their journey and help them in different ways to manage to be at a healthy weight.
Okay. Danielle, where exactly is Leaf Weight Management, the clinic?
We are in our brand new location. We're located at 1980 Ogilvie Road. We're inside the Loblaws at Gloucester Centre.
Okay.
We've been there for 2 years, but have just moved into a brand new space that is all our own and designed specifically for weight management care.
That's exciting.
Very exciting.
Very exciting. Okay, so Dr. Judy, what should I call you? Can I call you Dr. Judy? That
you
sounds
can
like
do
a
that. I know most people have difficulty with my last name. My husband's always like, you should have had my last name. His name is like so. Like,
okay. Well, okay, so what kind of weight loss are we talking about here? We're talking about extreme cases. Is that what you specialize in?
Not necessarily. Really, I mean, we say weight management. Our clinic is a weight management clinic. That being said, obviously there are people who have a higher weight and they're looking for more amounts of weight loss. But generally speaking, what we're trying to do is get people to a weight that they can maintain.
Okay.
And sometimes for some people it could be just a 5 to 10% weight loss that can make a significant impact on things like diabetes, high blood pressure, cholesterol, even sleep apnea, which is quite common. Yeah.
Can we talk about the word obesity, because that's something on these notes here, and it's something we need to tackle because the world, unfortunately, does seem to be getting a little bigger. People are having issues.
Yes.
What exactly does obesity mean?
Yeah, so, you know, it's interesting because I'm part of the guideline committee for the 2018 Guidelines on Obesity Management for Canada. And we've been wanting to work more on that definition of obesity. And essentially, you know, there's a traditional kind of BMI, body mass index, type of calculation, which we detest to a certain extent because it just tells you how big you are but not how sick you are. Looking in general in terms of a true definition of obesity, it's having excess adipose tissue or excess fat mass that impacts your general health. And that could be things, again, like diabetes or even just arthritis or even psychological.
Okay, so you don't really need to be like 100, 200, 300 pounds overweight. It's whatever is impacting your life in a negative way that counts as obesity.
Correct.
Interesting.
Yeah.
So, Danielle, this is where you step in. I mean, you know, because you're trying to get people on track in a better way when it comes to eating.
Absolutely.
What have you brought with you here today? You've got a few examples of some healthy eating.
Right. So we want people at our clinic to understand that weight management is not just what you eat and how you move, and that's where the physicians come in. But certainly part of self-management is improving, optimizing what you're eating and your physical activity. So we brought some examples of the kinds of things we might recommend at the clinic. So we can take a food focus approach where we're eating real food, healthy food, delicious food that's easy and quick to prepare. So I've brought an example of what a day might look like on a lower calorie eating plan that we would recommend.
So this would be a full day's worth of food then, okay.
That's right.
All right, so we're starting at your end, I'm assuming?
Sure, yeah. So this breakfast, this is an example that we've brought that's called peanut butter and jelly overnight oats. So this is something actually that you can prepare ahead, and you could even batch prepare it a bit. Mornings are often very hectic. You mentioned you have a very young one at home, so you know things are going in all directions, and sometimes you need to grab quick, maybe even grab and go. So these can be made up in jars ahead of time and taken with you or eaten at home.
Okay.
So it consists of some rolled oats. You can use milk or a milk alternative. This one has a peanut butter powder in it, as well as a protein powder.
Peanut butter is my favorite.
Yeah, and my favorite fruit in terms of berries is raspberry, so we use raspberries and raspberry jam.
Okay, so easy to put together.
Totally easy to put together. Quite honestly, I was at the clinic last night till 8 o'clock teaching one of our programs. I made all of this before I went to bed.
Oh, did you? Okay,
Yeah.
All right. So this would be the lunch portion then?
That's right.
Okay,
so
and that looks pretty straightforward.
Yeah, so in here we have a crunchy salmon salad with lemon and dill, and we've also got spinach and peppers and carrots added into the sandwich. One of the key things we teach our patients is to volumize with vegetables. So it's not about having small meals, it's having filling meals.
Okay.
And things like salmon are really good for giving us healthy fats that not only help our heart, but in weight management can actually help with things like improving our feel-good hormones like dopamine. So
Yeah.
we tend to be satisfied by our meals and not looking for those pick-me-up snacks in the middle of the afternoon.
Okay, and this looks like an amazing soup, I'm assuming, that you put together as well? So
Yeah.
what would be in there?
So this is a warm hug in a bowl.
I like that. I like the name of that.
A great soup for keeping you feeling satisfied. So, you know, if we're looking at weight management, we want to stay feeling satisfied. We don't want to be hungry all day long. So some of the things that we use to do that with are protein-rich foods. So this soup features lean ground turkey. It also has split peas. It's got slow digesting barley in there for healthy carbohydrate, keeping us feeling full. And it's also got butternut squash in there too, so lots of great vitamins and
Lots of
minerals.
great stuff. This looks like a full day of food here.
Yeah.
Looks tasty too. Doctor, so would you say that self-management obviously is, because people would come in and talk to you, both of you, and get on track, and then people just have to sort of self-manage what they're doing. They need to take care of themselves.
They do need to take care of themselves, but we also are there to not provide judgment or anything. I mean, there are circumstances that have led towards the excess weight occurring, and that isn't just necessarily because you didn't manage your day well. There's a genetic component, there's an environmental component. Medications in themselves can be a huge barrier towards managing your weight, like things like insulin. And so the whole point is to understand your general circumstance with respect to weight. And so controlling what you eat is one aspect, but there's so many others. And part of the reasons there's a physician involved is to go through that. One of the ways that we help our patients too is possibly the use of a meal replacement to help structure those days. There are some medications for weight management. That's something that we can discuss with patients, and there's also surgical options for weight management.
Okay,
Yeah.
so how would it work then? A person would walk into Leaf Weight Management, and would they meet with both of you or
So
one
there's
of you?
two ways of doing that. One, you can just call in and book a visit with the dietitian.
Yeah.
Also, generally to see the physician, you get referred from your family physician or nurse practitioner or one of your specialists, and it just starts off with a conversation.
Okay.
Yeah.
So it's beneficial to come and see you guys if you're feeling like you're not feeling your best.
Yeah.
Simple as
That's
that.
Yeah.
All right. So leafwmc.com is the
Yeah.
website to go to.
Yes, it is.
Live,
Thank you.
eat, activity forever.
I like that. Is that what you call an acronym?
Yeah.
Okay.
We're full of acronyms at least.
Good work.
Yeah.
We appreciate your time. Thanks for keeping us healthy.
Thank you.
Thank
Dylan.
you.
Coming up in moments right here on Daytime Rogers TV. How about this? A very cool networking event is taking place next week, and we have all the details in seconds. Don't go anywhere, please.